Do you always take painkillers after eating? Did you know that the answer depends on the type of painkiller? Taking the wrong medicine at the wrong time could irritate your stomach or reduce safety. Let's find out when to take NSAIDs and paracetamol. Painkillers are medicines that help reduce pain and fever. The two common groups are paracetamol and NSAIDs. People use painkillers for headaches, toothaches, muscle pain, back pain, fever, and menstrual cramps. Paracetamol helps reduce pain and fever, but has very little effect on inflammation. NSAIDs reduce pain, inflammation, and fever. Common examples include ibuprofen, naproxen, and diclofenac. Paracetamol can usually be taken with or without food because it is gentle on the stomach for most people. NSAIDs are best taken with food or just after a meal to reduce stomach irritation. Food helps protect the stomach lining from irritation caused by NSAIDs. Taking NSAIDs without food may increase the risk of stomach pain, heartburn, or ulcers. Always swallow tablets with a full glass of water unless instructed otherwise. Alcohol may increase the risk of stomach bleeding with NSAIDs and liver damage with excessive paracetamol. Never exceed the recommended dose, even if your pain continues. Taking too much paracetamol can seriously damage your liver. Long-term use of NSAIDs may increase the risk of stomach ulcers, kidney problems, and bleeding. People with stomach ulcers, kidney disease, liver disease, or heart disease should consult a healthcare professional before using painkillers. During pregnancy, paracetamol is often preferred when needed. While many NSAIDs should be avoided, especially later in pregnancy, unless advised by a healthcare professional. Children should receive only age or weight-appropriate doses using the correct measuring device. Always read the medicine label for dosage, warnings, and instructions before taking any painkiller. Seek medical help immediately if you have severe allergic reactions, black stools, vomiting blood, severe stomach pain, or suspect an overdose. Remember, paracetamol can usually be taken with or without food. NSAIDs are generally best taken with food or just after eating to reduce stomach irritation. Taking painkillers correctly helps you get the best results while reducing the risk of side effects. Always follow the label and ask your pharmacist if you're unsure. Follow PharmaWise for more trusted medicine advice.